Good evening and welcome to Pandemic Perspectives. My name is Amy Finley and I'm the Dean of Students at the University of Michigan-Dearborn. Welcome back for Pandemic Perspectives Week 4. I am so pleased to welcome you here tonight for our presentation, and welcome back to everyone who was with us last week. Tonight is our fourth installment of our exciting 6-part series led by faculty from a variety of academic disciplines across the university. So far, we've explored the impact of race on care and the example of the pandemic in London in the 1800s, and we've learned about the virus from the perspective of epidemiology. So if you missed any of these exciting presentations, please check out our Pandemic Perspectives website where all of the videos have been saved. At the conclusion of tonight's presentation, there will also be a question and answer session, so please do feel free throughout our presentation this evening to submit your questions through the Q&A button at the bottom of your screen. I'd like to now introduce you to tonight's presenter, Dr. Brenda Whitehead. Dr. Whitehead is an associate professor of psychology in the Department of Behavioral Sciences at the University of Michigan-Dearborn. She earned her BS in psychology from Northwest Nazarene University and her MA and PhD in lifespan-developmental psychology from the University of Notre Dame. She is about to start her 8th year at UM-Dearborn. She teaches courses in general psychology, human development, research methods, and aging. Her research specialty is gerontology, or aging, focusing on things like stress and coping as we age, the intersection of mental health and physical health, COVID, and psychological well-being. Dr. Whitehead's work has been published in top journals of her field, including The Gerontologist, the Journals of Gerontology, Journal of Health Psychology, and Psychology and Aging. When not teaching or doing research, you might find her being silly with her husband and her 3- and 5-year-old boys. So now let's move on to tonight's presentation. Dr. Whitehead, the floor is yours.
Okay, well, thank you so much to Amy and Paul and everyone else behind the scenes who has been organizing this series. I know I have really enjoyed learning so much from my fellow presenters, and I certainly hope to continue that tonight. As Amy stated, I study the intersection between psychology and health as we age, and much of my work focuses on the processes involved in stress and coping in later life. Although the topic of COVID-19 and older adults could honestly fill a whole course, my goal in this brief presentation tonight is to introduce some of the big picture themes, as well as to highlight older adults' own experiences of the pandemic based on my own research. So much of my work is based in stress and coping theory, which describes the stress experience, which is catalyzed by the appearance of a stressor, as happening at the intersection between the person and the context. So this framework actually provides a helpful organizational structure for tonight's presentation. So first I'll go into the stressor. I'll talk about some numbers and considerations related to older adults' risk for the novel coronavirus as this catalyzing event. Next, I'll go into the context. So we'll talk a little bit about cultural climate of ageism that has served as a backdrop for societal perceptions of COVID-19 as a quote unquote age thing. Then I'll go into the individual experience. So I'll highlight the different aspects of COVID-19 that older adults experience as stressful, as well as the different ways that people might cope with COVID-related stress. And finally, I'll finish up with what I call the resilience. So this is actually a list of pieces of wisdom and advice shared via the surveys that I collected from older adults to a pandemic world. And they really do demonstrate the resilience that is built over a lifetime of facing stresses and challenges. So let's go ahead and get started. Starting with the stressor. At the most basic level, the catalyzing event for all of this is the novel coronavirus itself and its impact on health and mortality. So I'm going to talk a bit about the numbers as they relate to age. So first, it's really important to reiterate that people of all ages can get and die from this coronavirus. and people of all ages have been impacted by the pandemic. It's clear from looking at this chart, which is from the Gerontological Society of America, that older adults are not the only ones at risk for coronavirus. But we can't deny that there are age-linked risks that are not captured from this graphic, okay? So since March, headlines have blasted age as the foremost predictor of risk when it comes to symptom severity and death. And as we see from this graphic from the CDC, mortality rates do get higher as we progress through demographic age groups. So this age effect has emerged around the world. So what is it about age? In gerontology and development, we talk about age a lot. Chronological age, meaning how many birthdays you've had, is almost universally a variable of interest in developmental studies. But do you know what else we say over and over and over? That chronological age is actually one of the poorest predictors of individual experience. Wait, what? So there's actually a really famous metaphor describing lifespan development as a fan. So in very early childhood, think infancy, toddlerhood, chronological age actually does tell you quite a bit about a person's abilities and developmental status, as there is just not as much variation among people. But as we move through life, accumulating diverse experiences, establishing diverse relationships, and reimagining our own values and philosophies, we get more and more different from one another. By the time we reach advanced ages, we are spread out from one another like the end of a fan. Now, this metaphor emphasizes what's called the heterogeneity that is present among the people clumped together by terms like older adults, seniors, retirees, or elders. Although I use the term older adults in this presentation for simplicity, it is important to remember that every time I say it, I am referring to a group of individuals with a variety of characteristics and life experience. So I'll refer to this heterogeneity or these individual differences throughout this presentation because it really is a foundational concept. So why then, if chronological age is such a bad indicator, do we use it? Well, it's very accessible and it's often linked with things that are predictive like health conditions. But we recognize it is not the causal variable, right? This brings us to what gerontologists refer to as biological age. So biological age compares the physical health and functioning of one's body to what is the norm for people of different chronological ages. So someone may be 60 years old, but they may have health conditions that put their effective biological age closer to the typical 80-year-old. Similarly, you may have somebody who is 85 chronologically, but they have a physical vitality more resembling the biological age of 60. So although chronological age does provide a helpful macro level indicator of an individual's risk for COVID symptom severity, a much more accurate risk assessment is provided by considering an individual's biological age, which is primarily indicated by physical health. And the data bears this out. So this image on the screen is a graphic that really depicts the differences in hospitalization rates and death rates, comparing those who have pre-existing health conditions with those who do not. And this is regardless of age. So we can see that those who have at least one pre-existing health condition are much more at risk for hospitalization and death. And when we bring in the age component, so this image depicts the proportion of people in each age demographic that has at least one pre-existing health condition, we can see that there is certainly a correlation here between chronological age and biological age, but not everyone who is older or quote unquote elderly does have this health risk, okay? So there is this biological age effect, and this age-related risk has not only influenced how older adults feel about the virus, how stressed they are about it, which is understandable, but also how younger groups perceive the virus as an age thing, as nothing to worry about, or even as nature's attempt at population reduction. The reality is, biological risk is just one small aspect of COVID-19 as a stressor. Now, I'm not meaning to downplay it, but there is so much else happening surrounding this biological piece. COVID-19 is impacting life and causing stress across life domains and age demographics. I've just listed a few here on this slide, examples of particular COVID-related challenges for these different developmental age groups. I'm going to talk in a lot more detail about some of these non-biological aspects of stress in the context of older adults in a moment. But before I get there, I want to highlight a key contextual factor that adds fuel to this stress fire, and that is ageism and the okay boomer culture. So unfortunately, COVID-19 entered a world already embroiled in deep generation wars, and the appearance of a virus that seemed to target those of a certain age just fanned the fire. As a whole new language emerged surrounding the pandemic, terms like social distancing and flatten the curve were soon joined by phrases like boomer killer, boomer doomer, and boomer remover. These terms were spread primarily via memes that popped up all over social media, like those I've shown here. So first we have this meme that says, when you find out COVID-19 is just a boomer remover, and you have an image of Angela, who is a character from The Office, a popular sitcom from a while back, saying, this is my favorite day. Celebrating the deaths of a group of people based on their age. This is troubling. The second meme is clearly also insensitive and ageist, laughing at the deaths of people of a very advanced age. These are, again, troubling. I have to be honest, I wasn't even sure if I should give these memes airtime because they're so awful and antithetical to everything I stand for as a gerontologist. But I decided that it was important to bring awareness to the vicious, overt ageism that has become even more evident in the age of COVID. Now, this didn't just all pop out of nowhere when COVID hit. The okay boomer phrase had already cemented the existing vitriolic divide between younger generations and the generation of adults born in the baby boomer era, which followed World War II and then moved into the 1960s. And as this graphic from the UM National Poll on Healthy Aging shows us, ageism is not rare. And the data for this was taken in December 2019, so this is pre-COVID. So from this, we can see that at this time, 82% of adults between 50 and 80 experienced ageism as a part of daily life, and 36% internalized that ageism, meaning they believed the messages that old is bad. These numbers are likely even higher post-COVID. So what is ageism and where does it come from? The definition of ageism is prejudice or discrimination on the grounds of a person's age. It's important to realize that people of any age can experience ageism. For example, a baby-faced college graduate may have a lot of difficulty landing a job that they are fully qualified for, but it is most common in the context of older ages. It is also important to recognize that people of all ages can be ageist. As the graphic we just saw about ageism reminds us, a significant portion of older adults themselves identify with ageist beliefs simply because it is so ingrained in our culture. So where does this ageism come from? Particularly in youth-obsessed societies like the US, there is this deep-seated fear of aging and active self-distancing from older adults. So as we get older, we find ourselves in nursing homes and retirement communities. We're directed to senior centers, and we're often kept at a distance from the rest of society. And this is despite the fact that, unlike is the case for other isms like racism or sexism, aging is universal, meaning barring the alternative, we're all going to be old eventually and at risk for experiencing ageism. So wouldn't younger generations want to treat their elders as they want to be treated when they're old? Unfortunately, our fear of aging leads us to protect ourselves by considering older adults as other. They're them, we're us, and we'll never be like that. The whole okay boomer thing is an example of this distancing, but this generational dynamic is not new. As this image reminds us, history is filled with instances of generations identifying themselves as different from the older generation. But every generation in history has in turn become that older generation, and in turn, at least in youth-obsessed societies like ours, experience the same prejudice. So when we see older adults as other and aging as something to fear, we tend to, often unconsciously, devalue the lives of older adults and see the older generation as lesser. This may lead some to decide the virus isn't so bad, since only those old people are dying, which of course isn't actually true. And this us-them distancing placed into the context of this existing generational divide on political and social ideas and fanned by the fire that is social media naturally gives us this boomer remover underbelly. Now, I do want to point out that those espousing terms like boomer remover are a very small minority, but they do represent an extreme version of an ageism that is woven into the fabric of our culture. And in the context of COVID, this ageism has led to conversations about who should have access to care or be prioritized during the pandemic. It's led many to not take the precautions they might otherwise if younger people, say children or teenagers, were the demographic most at risk. And it has led some people to discount high death counts that include a large number of older adults with phrases like, well, they were dying anyway, or how much time do they really have left? Older people are experiencing COVID-19 in the midst of this environment. Once again, stress and mental health do not occur in the vacuum of someone's head. They are by nature experiences that stem from the interaction of a person with her or his context. And when it comes to considering COVID-19 as a stressor, we cannot separate it from the context of ageism within which it is being experienced. So we've talked a little bit about the catalyzing stressor, the virus and its age risk. And we've talked a little bit about the context, this culture of ageism. We can now move into the meat of tonight's talk, which is the individual stress and coping experience. So when I began conducting my own study, exploring the psychological experiences of older adults early on in the pandemic, the conversation in the media was almost entirely dominated by concerns for physical health. And for understandable reasons, right? We didn't want to get the virus. We didn't want to spread the virus. But very little was being said in those first few weeks about the psychological implications of all of this. The thinking seemed to be, we'll take care of physical health for now, and we can deal with mental health once the physical risk had passed. Well, first, unfortunately, the risk hasn't just passed. And second, even if it had been relatively short-lived, we simply cannot separate physical health from mental health. They are not two separate pillars of existence that never touch. No, they are intricately intertwined vines that cannot help but influence one another as we move through life. Now, I won't go into all of the research highlighting this, but in light of the present context, I will mention research on immune function. So our immune system is incredibly influenced by our mental health status. Experimental studies have actually given people cuts and then manipulated their stress levels, and the cuts healed slower for those experiencing more distress. Our stress, depression, and anxiety influences our physical health and functioning, and our physical health influences our ability to effectively manage things psychologically. We cannot talk about one without the other. Mental health has to be part of the conversation when it comes to COVID-19. So let's talk about a key aspect of mental health, stress. A word for our times, is it not? According to the stress and coping framework, which I actually previously mentioned in passing, but I'm going to talk a little bit more deeply through right now. We approach our stress via two intermediate mechanisms, okay? So we start off with the appraisal mechanism, in which the person considers the stressor and its stressfulness. And then there is a second mechanism, a coping mechanism, in which the person engages his or her coping resources to combat the stress. Now, it's really important to note that coping is not engaged unless in the appraisal step, the stressor is actually determined to be stressful. Now, if we appraise a given event as stressful, we experience heightened levels of arousal. So psychologically, we might feel really hot, get that pit of the stomach feeling, get sweaty palms, feel our breathing and heart rate increase, feel a lot of muscle tension. You know this, right? You've felt this. Psychologically, we experience all of those what if thoughts, those feelings of overwhelm and persistent rumination, where constant intrusive thoughts about the stressor and everything that goes with it float around in our brains, often disrupting our focus, our sleep, and our functioning. So in the short term, this arousal represents our biological fight or flight response, where we are readying ourselves for battle with the source of our stress. This arousal prompts action taking as we recruit our coping resources in an effort to win the war, right? If our coping behaviors are effective in eliminating the stressor, or at least in reducing our arousal, then we are unlikely to experience any long-term effects from the stressor. We go back to homeostasis. But if our coping efforts are not effective or not quite enough, and that physiological and psychological arousal becomes chronic, that is when we start to see downstream health problems that wear and tear on the body. We might see hypertension, immune dysregulation, as well as clinical levels of depression and anxiety symptoms. So clearly, chronically high stress is not good. And this is true across the lifespan, but becomes particularly important for those in later life who are more likely to be dealing with those age-linked health challenges, often exacerbated by stress and its effects. So let's talk a bit more about the stressor experience. All right, what makes something feel stressful? I'm going to discuss 5 dimensions of stressfulness: onset, duration, controllability, clustering, and physical threat. As I talk about these, I'm going to also be incorporating some of the findings from my own surveys of older adults' experience during those early weeks of COVID-19. So this first dimension, onset. More sudden, unexpected stressors are more distressing. COVID, particularly the shutdown measures, were quite sudden and unexpected for most people. People were scrambling to stock up on everything from flour and bleach to toilet paper. Why? And routines were completely halted as schools, workplaces, community centers, and religious institutions shut down. When I asked adults 60 and over across the United States what they were finding most stressful or challenging during those early weeks of the pandemic, the sudden, unexpected nature of COVID-19 was captured in multiple response categories. So one of these is in the sudden imposed restrictions. So people listed things like having to cancel trips, cancel plans, the lack of freedom to do what I want to do. People talked about adjusting to change. So having to establish a whole new routine just out of nowhere. And of course, learning the technology to work from home. I know I can relate to that one. There were also responses that identified others hoarding as a key source of stress. So we have quotes like people hoarding paper products and finding items that are not available in stores. COVID caused a sudden rearrangement of normal, and that is incredibly stressful. The next dimension I'm going to talk about here is duration. So more chronic, unknown endpoint stressors are more distressing. And we, unfortunately, don't really know how long this new normal will last. I think most people would admit that it's going to be longer than we ever anticipated it being back in March. Now, this domain of stressfulness was also captured in my surveys. So I had many responses that fit into what I ended up calling the unknown future category. So nearly 10% of participants reported the most stressful or challenging aspect of all of this was the unknown, not knowing when it will be over, wondering when things will be back to normal. Not knowing how long something will last is incredibly distressing. And this unknown future concern actually also ties into the next dimension of stressfulness, which is controllability. So stressors that are outside of our control are more distressing. Although we can do small things to flatten the curve or slow the spread, things like stay home, wear masks, wash our hands, COVID itself is outside of our own personal control. And when I looked at the responses in my surveys, there were several categories that came out that fit into this overarching theme. So one of those had to do with the government. So we had responses related to federal leadership. Clearly, the government is outside of our control, at least when we're not in the voting booth, right? We had responses related to the news. Again, we can't control the news. This was back very early on when there was a lot of bad news coming from New York and Italy. A particular piece of our news experience that exacerbates this effect is this 24-hour news cycle, right? We're constantly barraged with headlines, and because they sell and people read them, often the headlines are negative, and we're constantly getting these hits of stressful information. And sometimes the best approach is just to stop, right? I know I have to do that for myself. It's so difficult when we can't control the news. We also aren't in control of the economy. So there were a number of responses related to concerns over personal finances, such as family business or retirement, as well as overall economy concerns. And of course, we can't control the behavior of others. So there were many responses related to other people's behavior, such as seeing people disregarding social distancing or people not taking COVID-19 seriously. Being in control makes us feel like we can fix it. We can do this. When we're not in control, we have to be more creative about how we cope. And I'll talk more about this in a moment when we get to coping. The fourth dimension of stressfulness I'm going to talk about tonight is clustering. So stressors that impact multiple domains of life are more distressing. COVID has impacted nearly everything: social activities, family gatherings, school, work, shopping, healthcare access, financial stability, religious practices, haircuts, the list goes on. This reality is represented in the diversity of responses to my most stressful survey question. So I know it may be hard to see all of the categories in this graph, but the fact that so many themes emerged really identifies the many domains of life that COVID touched for the sample of older adults in my study. And it's really important to recognize that although many of these categories are applicable to anyone, regardless of age, there are some age-linked considerations that might magnify some of the stress effect of this clustering for those experiencing some age-linked vulnerabilities. So one of these has to do with social isolation. So older adults, particularly those over age 80, are more likely to have lost a spouse and live alone. So even without COVID, these people are more at risk for social isolation. Add in the mandated physical distancing and the added fear about being around others, and this isolation and its impact on mental health is magnified. In my study, being married was the only demographic factor that emerged as protective against stress reactivity, which is a testament to the value of having at least one other person physically with you during a pandemic lockdown. Another age-linked consideration to be aware of is mobility. So with age comes a greater likelihood for transportation and mobility limitations. And this makes things like shopping particularly challenging for those facing these constraints. We add in the additional shopping-related risk of COVID, along with the empty shelves, and there were ration limits on things like milk, bread, and eggs. And it's no wonder that responses related to shopping earned the 5th most frequent spot in my study. So this represents a very practical way, actually, for neighbors or family members to help. We may not be able to physically be with somebody or take them somewhere, but I know some people who have just ordered a shipped order for an older adult who is not physically able to get out and get groceries. So this is something very practical that we can do if there is somebody we know, regardless of age, who is experiencing this COVID exacerbated isolation. We also might see more vulnerable financially. So we're generally aware that there might be some on fixed incomes relying on Social Security. There is a segment of those in later life that face financial strain or insecurity in non-pandemic times. The almost immediate impact of COVID-19 and the resulting shutdowns on the stock market and the overall economy was felt incredibly strongly by older adults, particularly those relying on investments for retirement income. There were a number of responses, as I mentioned previously, related to this financial stability piece when it comes to what is most stressful and challenging. Now, I know the stock market has recovered quite a bit since those early days, but we don't really know what's around the corner. Things are volatile, and with economic volatility comes added stress. We also might see an additional age-linked stress magnifier in the context of cognitive concerns. So, although not everyone experiences cognitive challenges as they age, biological aging does represent a higher risk for dementia and problems with memory and focus. So concern about cognitive symptoms is a major late life stressor in non-pandemic times, but over 5% of participants reported more problems focusing and getting things done as a result of the stress they were experiencing due to COVID. So, and those who reported that in my study had significantly higher stress levels than those who reported other primary stressors. So our minds represent our being, and trouble with our minds is extremely distressing. When it comes to this clustering, clearly older adults experiencing challenges in more than one of these domains pre-pandemic are particularly vulnerable to the cumulative stress that can come with COVID. So really important to be aware of these features if there is a particular person that is feeling distressed in this way. There's also the dimension of physical threat when it comes to what is stressful. So stressors that pose a true risk for our physical well-being immediately rise to the top in stressfulness. So unlike the vast majority of stressors in our current day and age, like 30-year mortgages or being late to work, COVID does represent a very real risk to the physical well-being of ourselves and our loved ones. And we already talked about the added age-linked biological risk faced by older adults. So when it came to those most stressful responses in my survey, responses from participants reflected this in this second most frequent category, this concern for others category. Statements like, I'm worried about the health and safety of my son and his family, or I'm worried about doctors getting sick. There was also a virus category, which was actually much further down the list, about 10th, but still identified concern about getting the virus oneself. So worrying about contracting COVID, or worried about what happens to my dogs if I get sick. So basically, COVID checks every box for stressfulness. Once again, however, the heterogeneity of experience of people 60 and older are clear. Everyone was experiencing the same pandemic, but different people who had different backgrounds and contexts and previous experiences and resources found different aspects most stressful. Now, it's important to realize that in circumstances like the times we're in, stress is a perfectly normal and potentially even adaptive response. It can engage us to reevaluate priorities, cultivate and strengthen resources, and get in tune with our mental health. But if the distress levels become too high for too long, that's when we encounter those problems. And that's why we need to talk about the importance of coping. So how do we cope when we're feeling this distress? When it comes to coping, how we cope depends in part on the degree of control we have over the situation. Now, I already mentioned how control makes something feel more stressful, or lack of control, I should say, makes something feel more stressful. A lack of control also limits what we can do to effectively deal with the stressor. So there are two primary ways of dealing with stress: problem-focused coping, which targets the stressor itself, and emotion-focused coping, which targets our own emotional response and perception of the stressor. When we have some control over the situation, problem-focused coping is generally best. So our finances are too tight, so we find another source of income, or we adjust our spending. Our roof is leaking, so we fix it, or we pay somebody else to fix it. Our back is killing us, so we go to the doctor or go to physical therapy. Ideally, problem-focused coping completely eliminates the stressor and the stress. When we don't have control over the situation, problem-focused coping behaviors are not only ineffective, but they can even make things worse. Trying to control something you can't is an exercise in frustration, just as anyone with kids, right? So when we have very little control, the most effective approach in managing our distress is emotion-focused coping. This might be seeking support from a friend or family member, going for a walk, saying a prayer, petting a dog, or just putting on a laugh out loud sitcom. Anything that helps us change our perspective or improve our positive feelings can be effective in reducing our distress and improving our mental health, as long as it doesn't involve unhelpful behaviors like substance abuse or complete denial of the situation. So in situations where we have some control, then utilizing both forms of coping is usually the most effective approach. So we have yes, no, and some. And again, problem-focused coping, if we can do it, always best. But in situations like COVID, emotion-focused coping is likely where we need to turn. So in my survey of older adults, participants reported many different emotion-focused coping behaviors that brought them comfort or joy during the early weeks of the pandemic. And once again, this chart is a testament to the heterogeneity of experience. So again, I know you might not be able to see all of these, but I am going to highlight some of the key clusters of responses that came out. So I'm going to talk a little bit about social connection as coping, faith, distraction, self-care, helping, and gratitude. So first, talking about the social connection piece. So social support is always one of the most reported coping approaches. But in the environment of isolation created by COVID, this social support became particularly impactful. So we see quotes talking about FaceTime with grandchildren, being home with husband and dogs. And in the context of COVID, these digital interaction sorts of responses, talking about video chats and social media, they emerged as one of the most common sources of comfort and joy in this particular time. So we learned that in-person support is ideal, yes, but this digital interaction can also be incredibly supportive. We also had many people identifying faith or religious coping as a key way of seeking joy and comfort during the challenging time. So especially for the current generation of older adults, religious coping is a theme that emerges over and over when older adults talk about how they cope with stress. And research demonstrates the effectiveness of faith in reducing stress levels. So people identified prayer, meditation, music, faith in God, being able to watch my church service online, which again is another testament to the blessing of technology in the current time. There were also many people identifying sources of distraction that help them cope. So people identifying quarantine humor or painting, reading, cooking. It might seem like distraction would not be a recommended approach, but research actually shows that in cases of little or no control, coping by distraction is actually an adaptive response. So as long as the distraction isn't something destructive, right? As I mentioned already. So go ahead and binge that show on Netflix or bake 16 different types of bread. Just make sure that this form of coping is complemented by some of the others, most especially the self-care. So self-care can take a number of different, it can look a number of different ways, but the most common response that fell into this category had to do with getting exercise. Many people reported going for a walk as their primary way of finding comfort or joy. And this is a way to get outside, right? To get out of the house, clear the head, get some nature. All of these things are research-supported ways of reducing stress. And physical activity, as we know, also has health and cognitive benefits. We then also have helping as coping. So we may not be able to control the stressor, but we can control the ways in which we help others. For example, many parents suddenly found themselves without childcare. So many grandparents stepped in to help with care and homeschooling. Participants also reported making masks, helping with food drives. We all have something that we can share, and research reveals helping to be a powerful way to cope with stress. We just may need to be a little creative in the times of social distancing. I'm finally going to talk about gratitude. So gratitude has been a hot topic over the past decade, and for good reason. Getting grateful has huge benefits for stress reduction and mental health. People in my study identified or shared things like getting joy from singing birds, the sunshine, my warm, comfortable home, that my family is healthy. Just taking the time to find one small positive thing amidst the COVID life can go a long way to rewiring our brains to focus on the positive instead of dwelling on the negatives that we just can't do anything about. So seek out the good news, or as Mr. Rogers famously said, look for the helpers. Now, all of these are research-supported ways of coping. And it's really important, though, that exactly how a given individual will choose to cope is different. There's this heterogeneity present again. So finding the combination of strategies that works for you, your loved one, or your client is really key. So what comes next? We've talked about the stress, the appraisal, the coping. Ideally, the coping is effective and you go back to homeostasis, right? But if stress levels are not effectively managed, if our coping efforts are not enough, that's when we can get to these mental health diagnoses, most commonly anxiety or depression. Although there is not a lot of published research yet on COVID and mental health in later life, there is already some evidence that older adults are experiencing higher levels of COVID-related depression and anxiety than younger folks are. And associations between these mental health conditions and factors like immune function, cardiovascular risk, and suicide risk really highlight the importance of stress management and mental health treatment during a pandemic. So what does mental health treatment look like in a COVID world? One word, telehealth, right? The vast majority of practitioners have transitioned their in-person sessions to virtual format. And this reality removes a lot of the barriers present for traditional care. But for those with limited internet access or sensory difficulties that make engaging with screens problematic, or who are just uncomfortable with technology, this telehealth reality can actually be a barrier. So reaching out to those who we may see as vulnerable to overwhelming distress, who may not be comfortable with telehealth options, they may benefit from some support, some encouragement, some training, getting them comfortable with that so that they can engage in this really important mental health treatment or therapy if it is needed. Now, I want to finish on a positive note. Although stress can result in these mental health challenges, it can also lead to positive change and growth in the form of resilience. So let's chat a little bit about that as we finish up here. Resilience is basically the ability to maintain positive well-being in the face of life's challenges, to ride the waves and not sink, to bounce back, to stretch and not snap. Is that enough metaphors? Although some people seem to be wired to be more resilient, there is a lot of evidence that resilience is built by experience. So this idea is that every time we have to deal with a challenge or a stressor, we build skills and resources, making us more resilient the next time something threatens to sink us. Although chronological age is not a guarantee of resilience, having lived more life does make it more likely that we have faced a buttload of stressors and built up this toolbox of skills and resources that help us deal more effectively with our stress. And this is one of the reasons that many studies find older adults to actually be less stressed or less reactive to stress than younger folks are. So what are some of the lessons that are gained through a lifetime of stressors and building resilience? The last thing I did in my survey was ask if you could share one piece of wisdom regarding the current situation, what would it be? Now, although I haven't had a chance to formally analyze this data yet, I wanted to share a few gems tonight. This too shall pass, and the best is yet to come. Have faith in the future, learn from the past, and live the present with love and determination. Take it slow and treat yourself with kindness. Worry does not help anything. Action does. Have several hobbies or activities that interest you to help keep busy and occupied with something other than the virus. Help as you can. Be grateful for the simple things in life every day, such as family, friends, sunshine, food, shelter, and toilet paper. Meditate, pray, do whatever brings you peace on a daily basis. And finally, we need to support one another and come together to fight the real enemy, this virus. Isn't it funny how these align so well with the research-based coping practices that we just talked about? There is a lot of value in a lifetime of experience. So the takeaways here to wrap up. First, remember COVID is not an age thing. Yes, there are age-linked biological risks when it comes to symptom severity and mortality risk, but this pandemic is impacting nearly every aspect of life for all of us, regardless of age. If we're going to get through this, all parties have to stop the us versus them generation wars and work together. Second, there is no one COVID-19 stress experience. There are many aspects of COVID-19 that different older adults may find stressful, and it's really important to remember that heterogeneity of experience. Similarly, there is no one way to cope with COVID-related distress. There are many strategies and resources that people may use that are cultivated across a lifetime of navigating challenges. Although I'm sure that many of us are discovering new ways of coping, building new resources as we encounter this situation that we've never had to experience before. And we also have to remember that, yes, stress is bad, but stress can also build resilience. As a stressor, COVID is really unmatched in its resilience building capacity. And as we struggle through this incredibly challenging time, let's not waste this opportunity for growth as we grow both individually and hopefully as a society. And finally, it is normal to feel stressed by COVID-19, no matter how old you are. But overwhelming stress for an extended period of time is a burden that no one should have to carry. So mental health awareness and treatment is so important, even if it has to be engaged in via a telehealth option. So please don't hesitate to seek help. And that is all that I have tonight. Thank you so much for your attention, and I welcome any questions.
Okay, thank you so much, Dr. Whitehead. We will now move on to our Q&A portion. We've had a lot of questions come in throughout the course of your presentation. So we'll start with this. Does ageism present itself differently in different cultures? Is ageism an American or Western phenomenon?
There is absolutely a cultural component. This sort of ageism that I was speaking of tonight is definitely more anchored in Western civilizations that are more, as I termed it, youth obsessed. Some cultures will not deal with the same sort of ageism if they, for example, place greater value on the wisdom or the place in the family of the older adult. So yes, there is certainly a cultural component to this, and the ageism I was specifically talking about tonight is much more squarely anchored in the US experience, certainly.
So are there times when stress can lead to positive outcomes?
Absolutely, absolutely. So I mentioned the resilience piece briefly. I didn't get a chance to go in incredible depth, but there is even, along with that resilience building component, there is even research on something called post-traumatic growth. So this is context of very intense stress. So things that you might typically associate with PTSD, for example, where some people are able to come out of those situations and they have demonstrated a growth in character or a growth in part of their person that they identify as coming from that. And actually some people in these situations say that if they could go back and experience and not experience the intense stressor that had led to this growth, they would not take that opportunity because they recognize that growth as part of who they are now and as an important part of their life.
Oh, that's really interesting. So our next question. I've seen some older adults who are not changing their lives much in response to coronavirus. They have said that they are worried that if they slow down or change their lifestyle, they might lose their physical or mental capabilities. What are your thoughts on this?
Yes, this is absolutely a great point. So staying safe and physical distancing, I hope, is not being interpreted as don't move. Part of my research involves what I call the function spiral. So this is talking about what can happen if older adults stop being active and engaging physically, and they have this sort of deconditioning process that can happen and accelerate the function decline that can happen with age, but it happens much quicker than it needs to. So no, please do not stop moving and stop engaging. Just try to find ways to do it that aren't obviously in huge crowds or in contexts that maybe elevate risk. That's why so many of the older adults in my study, I think it's amazing that so many were taking walks. I think taking walks around the block is, I would say, an incredibly safe thing to do. And it keeps you moving. It keeps your muscles moving. Gardening, many people mention gardening, even mowing the lawn. Anything that can keep you physically moving is so, so important, both physically and psychologically. Yeah.
I have taken many walks around the block and definitely say that that has been useful for me. So you mentioned the collection of surveys from older adults across the United States. Can you talk about any trends in the responses that you found that cluster by either state or region?
So I have not had a chance to process the data to that level, looking at differences by region. I do have a pretty decent distribution across regions. The largest portion is in the Midwest, but there is a pretty significant portion in the Southeast and the Northeast and kind of the Southwest. So I'm hoping that as I have time, which we all have so much time right now, right? I will be able to continue processing the data and find more about that, because there certainly could be regional differences, particularly at the point where my surveys were taken, which was very early on, where many parts of the United States were not yet experiencing the increase in cases that, for example, we were in Michigan or they were in New York at the time.
So I really appreciate this next question. How do you suggest that we beat back the sloth mode laziness that builds up for some of us? This is not my question. Inhibiting us from seeking out the coping mechanisms that you've discussed.
Oh, sloth mode, it's so real. Yeah, you know, there's something to be said for grieving, right? I didn't have a chance to really touch on this in my presentation, but sometimes it is important to take some time and not do that 5,000 piece puzzle or try to fill our time and days with all of these many things that, oh, I can get that coping resource and that coping resource and that coping resource. Sometimes we need to take that time to sit and be a little slothy, to grieve a little bit this lack of normal. I know I've had to grieve a little bit my kindergartner not getting his kindergarten year. We all have these things, these milestones, these changes that are real and reflect real grief. But if you feel like you've moved beyond that and have had a chance to process that and have given yourself some time, taken it slow, and you feel like you're ready to get into some of these more active ways of coping, but you're just not quite getting the gumption. Often people find accountability to be very helpful. So even if you live alone, you can have a friend who you call on the phone and say, so did you go on your walk today? The accountability is a huge piece of getting us moving. And also in the present context, this is an additional level of social engagement, right? Social support. So I really encourage folks, especially if they do live alone in their homes, to find somebody, even if it's not physical with you, somebody who you can engage with for that accountability. But you know, everyone's different, and you probably know what works for you when you need to do something, what motivates you. Maybe it's you need to motivate yourself in some way, have a prize waiting for you. Maybe you'll order that thing you've wanted from Amazon if you can kind of get yourself off the couch and do something other than the Netflix binging. But yeah, there are a number of ways to do that. Accountability, I'd say, is one of the best ones. And again, it hits that other check mark of that social engagement.
So that helps us segue nicely into the next question. Are there studies comparing the effects of digital versus in-person social interactions and their implications on mental well-being?
Sorry, I was dealing with the trying to get it to mute and it's not muting. Can you say that again?
Absolutely. Are there studies comparing the effects of digital versus in-person social interactions and their impact on mental well-being?
Yeah, so this is, research on this has obviously picked up a lot in the past few months. A lot of the research at this point has to do with access. So I mentioned some of the difficulties. We have some research looking at younger older adults, so maybe those in their 60s, and digital interaction with social support. We don't have as much information about those who are older simply because generationally, often they are not as active in those digital communication formats. There's also the sensory issues, like I mentioned, where we have some health or sensory pieces that make it more difficult for people to engage with the screen, or with, they might not hear as well via a video call. And so there are some things that are starting to be explored. Certainly, there are studies that have shown digital interventions, digital social support interventions, to be effective in improving well-being, improving a feeling of social support and social connection. Are they as good as in-person social support? No, not usually, but they're certainly better than nothing. And so this is certainly, again, this is one of the spots where I think it's a great opportunity for those of us who may be more tech savvy and may know somebody who's maybe been resisting taking the plunge, so to speak, into technology, giving them a hand, giving them a Zoom tutorial, and help them be able to engage in those ways. And that can really help those that are more physically isolated.
Yeah, we received a number of questions about whether or not sort of digital connection would have impact for particularly older adults, and if there is sort of a disproportionate effect of social isolation on older adults. I guess, what are your thoughts about that? Is it disproportionate?
So social isolation generally, there are some personalities that are fine with it, right? And that's a reality. So there are some people that are perfectly happy right now. But social isolation, for those who do not want to be socially isolated, is incredibly problematic for mental health and also physical health. It affects, as I mentioned, they go together across age demographics. But because older adults, as I mentioned, are more likely to have just fewer network supports. So maybe they've lost a spouse. If they're at very advanced ages, maybe many of their friend supports are gone. Maybe they, mobility-wise, can no longer attend their church or synagogue or mosque, and so they've lost some of those social support connections. So they whether they have tried to on purpose or whether it's just happened as time goes on, many older adults do not have the network of social support that many in earlier life do. And so that's where we typically see the discrepancies of greater vulnerability is in the lack of social support and the greater likelihood of social isolation becoming a problem.
So this is probably our last question based on timing, but this question says, it's my understanding that some older adults may be resistant to the idea of seeking help for psychological or mental health challenges. Excuse me. First, in your experience, do you find this to be true? And if so, do you recommend any strategies that people can use when they reach out to support aging adults who might be resistant to these types of support systems?
Yes, this is absolutely the case, particularly for the oldest generation. So not in this study that I'm referring to tonight, but in previous work I've done where I bring older adults into the lab and many 80-year-olds, 90-year-olds coming in, there is kind of often a sense that psychological well-being or mental health is not real like physical health is. And this is because of there isn't as much awareness or education when those folks were going through school. There is a hesitation to seek help. There is a sense of it being for those people who are crazy, or it's very much, there is a lot of hestation, many in these older adult age groups, of engaging in mental health treatment. Strategy-wise, it's difficult. It's really important, and I say this regardless of the topic. don't talk down to anyone. These are people with a lifetime of experience. They are very smart. They have reasons for believing as they do. And it's really important as the younger person or the one who knows all about mental health or can fix things to not rush in and say, this is how it is, and this is what you need to do, and this is how to do it. And this needs to be a conversation. This needs to be a conversation that you have with somebody who you see as an equal in terms of personhood. Again, often we talk down to people who are older than us. Maybe they can't hear as well, so we talk louder and we talk dumber, right? That's not okay when it comes to speaking with our grandparent or a great-grandparent. So we have to be very conscious of how we're approaching this. And if we can approach it in a way that is respectful and is conversational and is collaborative, that's when it's more likely to be received positively than if we approach it as, I know everything, you know nothing, and this is how it needs to be. So yeah, I guess that's what I'd say there.
Okay, great. Thank you so much. So that concludes the formal portion of tonight's presentation. I just want to remind you of a few housekeeping details. The link that you use to access tonight's presentation will be the same link that you use each week to access our course. All of our presentations are recorded, and those recordings are uploaded to the Pandemic Perspectives website within 24 hours. So if you want to watch it again, you are more than welcome to. Just wait till tomorrow. In the Canvas site, students will find a 5-question quiz. Please be sure to take the quiz no later than next Monday night at 11:59 p.m. And as a reminder, to earn credit, you must participate in our sessions, complete the quizzes, and then complete a reflection assignment, which will be provided in the next couple of weeks. Lastly, I just want to invite all of you to join us again next week. Next week, our presentation will be by Dr. Pamela Aronson, who will discuss how the COVID-19 pandemic has drastic implications for the transition to adulthood, which was already precarious before the crisis hit. The presentation will consider how the COVID-19 pandemic is disrupting the transition to adulthood and exacerbating inequalities during this pivotal life course stage. It considers how changes in the markers of adulthood, including education, employment, and economic independence, leaving home and family formation, are all affected by COVID-19, as well as the trends of increasing inequality, the experience of vulnerable groups, and the implications for policy. Do join us. Thank you again for being here this evening, and special thanks again to our team who's been working diligently to put this series together for you. Have a great week. We will see you next Tuesday. Good night.